Hello, everyone. Thank you so much for tuning in or joining me today. My name is Jason Andrade, and I'm the Director of Financial Planning here at Nubian Square Investment Advisors. Today, I will be presenting on upcoming and really important changes that are soon to happen or impact the Affordable Care Act. We put this presentation to get today, put this presentation together because we know that right now there's a lot of noise and, frankly, a lot of fear surrounding healthcare. Between rising costs, changing regulations, and the complexity of the system itself, it's really easy to feel overwhelmed. Healthcare is it's about your well being and your family's security. At Nubian Square, we believe that clarity is the antidote to uncertainty. Our goal today is not just to lecture you on policy, but to give you a clear, actionable roadmap so you can navigate these changes with confidence. We want you to leave here knowing exactly what to look for and how to prepare financially for what lies ahead. I'm going to share my screen now and we can start the presentation. So let's dive into navigating the new ACA landscape changes you need to know. We're going to cover how the system works today, but more importantly, we're going to look at the financial implications for you and your household. Slide 1, ACA fundamentals. We've broken this workshop into two distinct parts. In part 1, we're going to go back to the basics. Whether you've been on an ACA plan for years or looking at it for the first time, it's crucial to understand the fundamentals, what the law actually guarantees, how the money works, and how to shop the market effectively. So, what is the Affordable Care Act? First, let's define what we're actually talking about. The Affordable Care Act, often called Obamacare, is more than just a website where you buy insurance. It is a comprehensive reform law designed to make health care accessible and, crucially, comprehensive. Before this law, insurance companies could deny you coverage based on your medical history. Today, one of the most crucial protections is for pre-existing conditions. You can't be denied coverage or charged more just because you have asthma, diabetes, or a history of cancer. The law also mandates that every qualified plan must cover 10 essential health benefits. This ensures that you aren't buying junk insurance. Your plan must cover things like emergency services, maternity care, mental health treatment, and prescription drugs. Additionally, it allows young adults to stay on their parents' plan until they turn 26, which is a massive relief for families. It assures that preventative care, like your annual physical and screenings, is covered at no extra cost to you. So, how do the subsidies work? Now, the biggest question we get is, how can I afford this? This is where the subsidies come in. There are two specific types of financial help you need to understand. The first is the premium tax credit. Think of this as a discount coupon applied directly to your monthly bill. The government pays a portion of your premium to the insurer, and you pay the rest. This is available to most people based on income. The second is less known but very powerful: cost sharing reductions, or CSRs. While the tax credit lowers your monthly bill, CSRs lower your risk. They reduce your deductible, your copays, your out-of-pocket maximums. However, there is a catch. You must enroll in a silver level plan to trigger these extra savings. If you qualify for this and buy a bronze plan, you're leaving money potentially on the table. So, navigating the health exchange. So, how do you access these benefits? You do it through the health insurance marketplace, often found at healthcare.gov or your state-specific exchange. The process is a 4-step cycle. You create an account where you start by entering your household details: ages, income, how many folks live in the household. That allows you then to check your eligibility. Before you even look at a plan, the system will calculate the subsidies we just discussed based on your estimated income for the coming year. You then will be able to compare plans. You can then view plans side by side. And then lastly, or step 4, is to enroll. And once you select a plan and pay your first premium, your coverage is active. It sounds simple, but the compare plan step is where people often get stuck and potentially can make some really expensive mistakes. So, key factors in choosing a plan. When you're comparing those plans, do not just look at the monthly price tag. You have to weigh 3 important and competing factors. Premiums, this is your fixed cost, what you pay every month just to have the card in your wallet. Number 2 is the deductible. This is your risk. It's what you have to pay out of your own bank account before insurance companies start paying the big bills. A low premium often means a very high deductible. And number 3, network. This is often overlooked until it's really too late. Is your doctor covered? Is the hospital down the street in network? If you go out of network, you may end up paying 100% of the cost, regardless of the insurance you may have. So now let's transition to part 2, or recent changes. So the first portion really covered how the system works now, but we as financial advisors, our job is to look at the horizon. So in part 2, we need to discuss the significant shift that's coming, specifically regarding the cost of these plans. The subsidy cliff returns. For the last few years, we've been in a unique period. The American Rescue Plan and the Inflation Reduction Act temporarily pumped extra money into the system. This made subsidies larger and available to more people than ever before. However, these enhanced subsidies are set to expire at the end of 2025. What does this mean? Unless Congress passes new legislation, we will return to the old rules in 2026. This means millions of people could see their premiums jump up significantly overnight. It's what we call the subsidy cliff. Now, hypothetical premium increases. Let's look at the numbers to see what this reality might actually look like. These are hypothetical projections, but they illustrate the scale of the change. So let's look at the family of 4 on the left. With the current enhancements, they may pay around $350 a month in premiums. If those subsidies expire in 2026, that same plan could jump to over $600 a month, almost double. We see similar jumps for individuals and couples. And this isn't just a few dollars, right? For many households, this could be a budget-breaking increase. This is why we're having these conversations now, so you aren't blindsided when you open your renewal letter in late 2025. So what are some alternatives and supports? If you do find yourself, unfortunately, priced out of the marketplace, or if your income situation changes, there are alternatives. Medicaid and CHIP. Always check your eligibility here first. Income limits vary by state, but if your income drops, this provides comprehensive coverage at little to no cost. There's also catastrophic plans. If you're under 30 or qualify for a hardship exemption, you can buy these specific high deductible plans. They're designed purely for worst case scenarios, and we would hardly call them, and they're not comprehensive coverage. And then community health centers. If you end up without coverage, no, community health centers do exist, and they provide primary care on a sliding scale based on your income. So what are some key takeaways here? As we close, I want to leave you with 3 specific to-do items. Review options thoroughly. Do not auto-renew. Costs change every year. Also, look outside the exchange. If your spouse has an employer plan, run the math. If it seemed expensive before, it might be a lot cheaper than a marketplace plan without enhanced subsidies. Prepare for increased costs. Hoping things don't change, it really isn't a strategy. So start building a dedicated healthcare savings buffer now. Also, audit your medications. Make a list of what you take and the cost it out so you can accurately predict your needs for this next year. And then lastly, this is where we come in. Consult your advisors, your financial planners. And this is where we want to really support and help. Connect with us here at Nubian Square Investment Advisors. We can help you look at your adjusted gross income and maximize your subsidy eligibility. We can also help you fit these rising healthcare costs into a broader financial plan. So, lastly, um, I know there is a lot of questions around this because healthcare is complex, but you don't have to navigate it alone. We're here to help and provide you clarity and security. So, I really appreciate you guys taking the time to watch this video. And again, remember, if you do have questions, we might be able to help. Don't reach out. Nubian Square Investment Advisors are partners, and we're here to help and serve our communities. Thank you.